The purpose of PARO is for like two purposes. One is for pet. The other is for therapeutic purpose. And as for pet, so as like dogs or cat, we can interact with PARO at home. And it's like companion. And as for the therapeutic purpose, so people may know about the animal therapy. So interaction with animals have a lot of benefit to human beings. And for the therapeutic purpose of PARO, the PARO has different characters from the PARO for pet. And I designed PARO to be more like appropriate to be used for therapeutic purpose. But in the case of the children with autism or developmental problems, so there are some other opinions. Yeah, for example, if children do something bad to PARO, it may be better to express some negative reactions. At the time, therapists can tell them, oh, PARO feels bad, so you shouldn't do such kind of action to PARO. Then they can teach the children with developmental disorders how to socialize with others. Yeah, so depending on the purpose of therapy and also subject, there may be more different characters for PARO to be therapeutic.
At first, Dr. Takanori Shibata developed PARO to help nursing homes in Japan that were devoid of life. As such, PARO was first invented to be a companion for the elderly, but it soon turned into being a therapeutic robot which can help many more people, from children to elderly. Contrary to cat and dogs robots, which tend to be disappointing for patients, PARO, thanks to its unfamiliar appearance and behavior, captivates the patients and helps them relax. In some cases, PARO brings back some precious memories. Most importantly, PARO eases the communication between patients and their medical staff or family members by triggering their social skills.
In the case of a baby seal or some other unfamiliar animals, probably so people do not compare the robots with image of real like baby seals, and they can easily accept it. And a lot of people have a good image towards baby seals, and they would like to save or protect the baby seals naturally.
People did raise some concerns about ethical issues regarding robot medical care and the use of PARO. But Dr. Shibata strongly believes that it is just a matter of time before people start to accept the help of robots, especially PARO.
When we introduce PARO or robot or even technologies in some new field, some people are afraid of such introduction of the new technologies or new robot or even PARO. And of course, there are a lot of people who accept them very quickly and easily. The people who are very afraid of such introduction, it may take time for them to accept them. So once they understand some new technologies or PARO are safe for them, for example, and also good for them, if such technologies improve their quality of life, so they start to accept the new technologies. It takes time for technologies to be accepted by societies. And of course, technologies should be think of or take care of the safety issue, privacy issue, and some others in order to avoid any conflict or difficulties with the people.
Dr. Shibata already had the opportunity to introduce PARO in Thailand, but it is yet to be recognized as a medical device. However, some hospitals are already putting PARO to the test.
At the Chulalongkorn University, they have a kind of day service center for the elderly people with dementia. And they have been using PARO. And so it's not clinical trial, but they are collecting some kind of cases. We had a kind of project of Princess Shillington. Yeah, so she had interest in supporting the children. So we had a joint project about PARO. So she was a kind of sponsor of the project in Thailand, actually. Yeah.
16 Lozhal, reporting for Thai PBS World.